enter the room.
Hello.
Hello.
Yes. Hi, doctor.
Hello. Am I speaking to Andrew Sutton?
Yes, that's correct.
All right. I'm Dr. Farisha. I'm calling from the GP surgery. Am I audible to you?
Yes, doctor, I can hear you well.
Okay. Could you please confirm your address for me?
My address is Stockton Road, Durham, United Kingdom.
All right. Could you please confirm your age?
I'm 55.
All right. Is this a good time to talk?
Yes, doctor.
All right. Could you please say me why you made an appointment?
Well, yes, I'm calling to find out if I could get my PSA tested.
All right, Andrew. Let me ask you a few questions in order to have a better overview, and after that, let's see what we can do for you. Is that all right?
Oh, sure, doctor.
May I ask you why you want to do a PSA test?
Oh, well, you see, doctor, a friend of mine was recently diagnosed with prostate cancer, which is spread everywhere. So I'm
Mm-hmm.
interested for the same. So I thought I should get all the tests done and be sure.
Mm-hmm. I'm really sorry to hear about your friend. May I ask you what you know about the PSA?
I just know that that was the test that he did to find out about his cancer.
Mm-hmm. All right. And let me ask you, do you have any symptoms right now?
Symptoms like what, doctor?
Do you have any problem with your urination?
No, not really.
Okay. Do you have increased frequency to go to the loo?
No.
All right. Do you feel like you have to rush to the loo?
No, doctor.
All right. Do you feel it will be difficult to start the urination?
No, not really.
All right. Do you feel like you are losing weight?
No, doctor.
And how's your appetite?
My appetite is fine. I eat everything.
All right. And do you notice any lumps or bumps anywhere in your body?
No, doctor.
All right. Let me ask you some of your medical history. Have you been diagnosed with any medical conditions before?
No, I've been perfectly fine.
All right. Any conditions related to your prostate, like enlarged prostate?
No, doctor.
All right. Are you taking any medications regularly?
No.
Okay. Do you have any family history of prostate problems?
No, my family has been pretty fit.
Oh, that's glad to hear. All right. And do you allergic to anything?
Not that I know of.
Okay. All right. Let me ask you some of your lifestyle questions. Do you smoke or do you drink alcohol regularly?
No, I usually tend to avoid that.
That's good to hear. And are you physically active?
Yes, I do enjoy playing golf.
That's great. And what do you do for a living?
I'm an accountant, doctor.
All right. So, Andrew, thank you for patiently answering all these questions. I can understand that you are very much anxious about your prostate and want to do the prostate-specific antigen test that you mentioned, PSA. So, let me explain to you what is PSA first. Is that all right?
Sure, yes, I'd love to understand.
All right, Andrew. So PSA is the protein which is produced from the prostate gland, which is a gland present at the neck of the bladder, urinary bladder. It is a walnut-sized gland. All right. So this PSA can be produced from the prostate normally and also in certain abnormal conditions, which is related to prostate, one of which is prostate cancer. Am I clear?
All right, yes.
Mhm. So let me ask you what is bothering you the most?
Well, I just want to, make sure that my prostate is pretty healthy, and I
Mm-hmm.
don't have such
Mm-hmm.
issues like my friend did.
Mm-hmm. All right, Andrew, I can see that you're very much concerned about that. So This PSA testing is usually not a part of the regular screening in UK, but we can provide PSA testing for anybody who's elderly more than 50 years of age, if they want to do so. But before that, I want to mention something about the PSA test. Okay. This PSA test is not a specific test for prostate cancer. There are various conditions where a PSA can be increased.
Okay.
Am I making sense?
All right. Like what conditions, doctor?
If you have an infection in your prostate, we call it prostatitis, or in case normally also the prostate specific antigen can be increased in the elderly people, and also in case of cancer. All right. So usually we do the PSA test only if the patient is symptomatic.
2 minutes remaining.
Like if the patient have any symptoms related to the prostate gland.
All right. Okay.
So from my assessment, you are not having any kind of symptoms related to your prostate. That's a really good thing. So okay. Do you have any concerns?
Yeah, but I mean, I getting the test done. I mean, that way I could find out for sure if I could have cancer or not, right?
All right, we can do the test for you. But before that, there are certain advantages and disadvantages for this test. Okay. Obviously, the advantage is we can find out the prostate cancer if it is present. But there are certain disadvantages, like it can be false positive.
What does false positive mean?
I will explain to that to you. If your PSA is increased normally, and you will become very anxious about that, and we have to do further investigations like biopsy, which can be very painful and all. So it can be very unnecessary investigations.
All right. Okay.
So that is why usually we do a prostate specific antigen test only in case if it is really needed.
All right. So since I'm symptomatic, I don't need this. Is that what you're trying to say?
Yeah, since you are not having any kind of symptoms and you're healthy now, so it is really not recommended for you to have this test. But if you really need it, we can assist you with that also.
All right. Yeah, sure. Yeah, that makes sense.
So, what is your decision?
What happens then?
If you are going with the test, I'll be giving you certain instructions so that we can follow after coming to the test.
Move on to the next station.
Good job. I mean, you did a lot of good, explaining there, and I was really impressed by the way you were actually explaining what a PSA is. But the main thing is, you can't. I wouldn't say that you should say you recommend.
Okay.
Because even without symptoms, you can actually have prostate cancer, can't you?
Yeah, yes.
It's not that since he's asymptomatic, you don't recommend it. You have to actually tell him the benefits and the drawbacks properly. Saying that even if PSA does come high, it doesn't always mean that it could be prostate cancer. Prostate cancer is just one of the causes.
Okay.
State of false positive. Explain that false positive a little bit. Meaning, even without any, prostate cancer, the PSA can be a high, right? But if it does come high, we would have to investigate it further to rule out any possibilities of cancer. So this may actually cause you a lot of distress going through the entire process. That is something that you can explain. So that is the drawback. So because a lot of people, I mean, if you actually tell somebody that there may be a chance of cancer for some thing that is not that specific, I mean, I think somebody's given the specific percentage. There's around 75% specificity to it. It's pretty low. 75% is actually pretty low. Usually for a specific test, you don't actually take something less than 80, for a gold standard, and this is nowhere near gold standard. So definitely you would actually have to tell him that, even though since, it may come high, we will have to put you through all that, right? And it's not, and most of the times, you might not, and some, often times than not, you may not actually have anything related to prostate cancer, right? So that is the drawback of this. It's not very specific, right? And also the sensitivity aspect of it, meaning that, even if it does come low, it doesn't rule out the possibility of cancer as well. Do you understand?
Yes, yes, right.
So you have to explain both the aspects, so it's neither sensitive nor specific. So there you go. Uh, so let's quickly look at the performance. So we have the performance sheet that Dr. Rohit has marked. I will quickly pull it up for you. Just one moment. Yep. One moment. I'll just share my screen to that screen. All right, there you go. So, greet Andrew warmly, introduce yourself, confirm name, age, address. I think you did this, right? You did all the three. I'll give you a yes for that. Telephone etiquette, check connection. If this is the best number to get back. Yeah, I think he did this one as well. Oh, you didn't ask full name. All right. So that is the thing. Okay. So did you ask full name for the patient identifier?
I think I didn't ask the full name.
Yes, then definitely
Yes.
your marks will be reduced for that. So definitely keep that in mind. All right. Then focus history. Ask Andrew about the main concerns why he wanted a PSA test. This is very important. Even though you may, so whenever somebody comes up with an investigation saying that I want this test, two questions that you should always ask is, what do you already know about the test? Why do you want to have it, right? What do you know and why? These are the two questions you need to understand to, before you go into the symptomatic questions. So good job on asking that. Inquire about any family history. That's a big risk factor. Ask about any symptoms, back pain, weight loss, blood in urine. Yeah, these are very important ones, back pain, weight loss, blood in urine, and then the LUTS symptoms, right? Ask about any systemic symptoms. Again, back pain, weight loss, fatigue, blood in urine. Assess lifestyle factors such as smoking, alcohol. Smoking is a very big risk factor for prostate cancer, so that is something that you must ask. Ask about previous PSA tests and their results, if any, past medical condition or medication that he is on. Empathize and validate, express sympathy for the concern about the friend's cancer, ask if his friend is doing well. This is something that I see nobody is actually bothered about, His main concern was that I'm doing this test because my friend has cancer. All right, your friend has cancer. That's understandable. Everybody gets cancer. I mean, you shouldn't have that attitude, right? So always have, show some empathy. These are points where the examiner is seeing if these are the openings where you can actually show the examiner that, you heard that his friend has cancer and he's empathizing. So definitely take advantage of that. As soon as you see something distressing that the patient is sharing with you, reciprocate to it, say something like, oh, I'm so sorry to hear about your friend. How is he doing? Say a few words, just in lines with comforting him about his friend's condition. Yeah. Otherwise, ICE, definitely, whenever it comes to a counseling case, always understand ICE, because what he might have a misconception because of which he wants to get this test done. You need to understand his perspective of why he wanted to get these tests done, So counseling cases, always think about asking ICE, because they may have a preconceived notion that you would want to have a better idea of, and you would want to clear it moving forward with the discussion, right? All right. Explain the test. Explain PSA is produced by both normal and cancerous prostate cells. Clarify PSA is not very specific for prostate cancer discuss that raised PSA may include prostate cancer, but can also be due to benign enlargement or infection of the prostate. Yeah. Any manipulation of the prostate, even if you do a DRE, there is a little rise in prostate. So, the rise is actually very little, but the DRE is a prerequisite before doing the prostate cancer, prostate testing. So even any manipulation, even if it be like catheterization, where you might be going somewhere close to the prostate, if it's ejaculation, even if with rigorous exercise, your prostate, your PSA levels or any infection, your PSA levels can actually go up high. So you actually have to warn them about that, some certain activities to avoid before getting the test done. Right, that is also something that you can mention. And apart from that, also infection or any benign enlargement can also be what to say, causes for rise in PSA. Outline the steps following a raised PSA. Further investigations like MRI and biopsy. Mention that raised PSA requires further evaluation. Discuss treatment option if cancer is detected, just in case, because he is worried about this, just a little idea of what would happen, if it is detected, like, watchful waiting, surgery, radiotherapy, and hormonal therapy. Discuss implication, explain that a normal PSA reduces the likelihood for prostate cancer, but does not rule it out completely. Explain the advantages of PSA testing, possibility of early detection and treatment. Explain the disadvantages, possibility of false positive leading to unnecessary investigation. Offer to perform prostate examination. Discuss the possibility and procedure for PSA testing. So one thing about PSA testing that nobody's telling anybody is that it's a blood test. You need to mention that fact, that what is this PSA? What are you testing? You're testing the blood, right, for any of these antigens. So definitely mention what the test is as well. Provide written information, leaflets, or email. You can send him a few more, information regarding this test and the possibilities of having prostate cancer. Safety netting. Advise Andrew to watch back pain, blood in urine, nocturia, frequency, and weight loss. Interpersonal skills, communication, use clear, non-technical language. That was done properly. Yeah, there is a lot of instances where, some of the technical languages, words can creep in. Allow Andrew to ask questions and provide thorough answers. Good job on that. Reassurance, reassure Andrew about the steps involved in PSA testing and subsequent action based on the results. Offer emotional support regarding his fears about, prostate cancer. See, another thing that you could have mentioned that, is that, he has no risk factors. That is also one way you can actually mention, saying that you have no family history, you don't smoke, and you've not had any symptoms. So these are actually risk factors that would indicate, someone to have prostate cancer. And in your case, you don't seem to have any. You can actually say that. Right, and then say that PSA testing, it does not usually mean, even if the results come high, it does not really mean that, the patient might have prostate cancer. And even if it does come low, it does not rule out the possibility. So I just want to, mention that to you about PSA, right, before you go in for this test. Because that is the most important thing, because they are, at this point, you can see that this person is heavily relying on the PSA, whether or not he could have, the possibility of having prostate cancer, which is not really the case, right? So that is something that you need to communicate to this patient. But if he does have a high PSA level, he would be needing to go for, further testing in the form of the 2-week referral pathway, cancer referral pathway. So that is the disadvantage. So one other thing about prostate cancer, it's something known as an indolent cancer. Have you guys heard of this term before? So this actually means that this is a very slow growing cancer without much symptoms initially. Right, so even if the patient had to go through the entire, routine of testing and, getting treatment, it would actually increase the burden in his life as compared to if he had to go without knowing that he had cancer. Right. So that is one interesting thing about, prostate cancer. Since it's such a slow growing cancer, it's not given, so much importance for screening. Only if there are symptoms, then only would you actually want to go in for testing. For an asymptomatic person to actually get the PSA testing done, and even if they do find out that he has, prostate cancer, it would be a while before it starts getting, at a phase where it's really, affecting his daily life. Instead, if you actually start treatment, it will start affecting their daily life more sooner as compared to, if they hadn't known. So that's one paradoxical thing when it comes to prostate cancer. Now, how about I actually write a small blog about this and tell you everything that there is to know about prostate cancer and PSA testing? Yeah, I think that would be very useful. All right, moving on to a couple of other interpersonal skills. Provide information on lifestyle changes that can reduce the risk of prostate cancer. So you can actually tell him a couple of risk factors, to avoid in order to reduce any risks for having prostate cancer. Legal and ethical consideration. Handle the situation with sensitivity and professionalism. Ensure Andrew understands his options and respects his preference. Absolutely. Examination, I think I'll give you a tick for issues as well, because the main thing to communicate to this patient is to tell him that, PSA, as you think is the reliable indicator for prostate cancer, is actually not that reliable. That is the main essence that you need to get out of this case. So make sure to do that. All right. Otherwise, everything else was great. So great job, Dr. Farisha. That was.
Please like and subscribe to TuringMedSchool. Good luck with your preparation.